Hi, my name is Pinky Gilani. You are watching What Women Want on Pinky TV. And if you're watching on YouTube, make sure you subscribe to this channel to get more conversations like this. If you're on Facebook, leave us a comment. Let us know where you are watching from. These conversations are brought to you by SBM Bank, and we are filming at Gem Suites in Riverside. So today we are joined by somebody very special, and our conversation today is going to be really interesting. So I suggest you stick with us. Ciru, welcome to What Women Want.
Thank you for having me.
It's so nice to meet you and to talk about you talk with you off camera.
Yeah.
Ciru, on What Women Want for season 3, our theme has been unlearn.
Okay.
So the first thing that we teach our audience is to unlearn the fact that they will be introduced. You know how it is when you go somewhere like it. You've been on TV shows. Everybody introduces you. So we're teaching our audience to introduce themselves, completely own it unapologetically. So I'm really throwing you in the deep.
Okay.
I hope you don't mind.
Thank you.
But please introduce yourself
Okay.
and tell us everything about you.
Oh, wow. All right. My name is Ciera. I'm a lover, a nurturer, a carer. And I'm the founder of Nurturing Moms. And Nurturing Moms is a company that I run that helps support, educate, and empower moms through their pregnancy journey, their breastfeeding journey, their motherhood journey, and help them have a much easier experience so that when they think about it and when they go through it, that it's joyous and it's pleasant. So my background is in nursing. I have a degree in nursing and a master's in public health. So I call myself a public health specialist focusing on the maternal and infant health.
Wow, it must be a very interesting time for you, especially with what's going on in the world.
Yes.
Yeah, so like you must be discovering so much about health, and then, like you said, maternal health, and so much more. Probably you've been exposed to or have had exposed to you. Am I right in saying that?
Yeah, absolutely.
Yeah. So before we get into that,
Okay.
let's find out who Ciru is. Like, you know, your upbringing. What made you decide that I want to be a nurse?
Wow. Way before that, I wanted to be a social worker.
Okay. Similar.
Yeah,
isn't it?
very close. And my
Yeah.
dad was like, what? You're not going to earn any money.
Oh,
So I was like, okay, fine. What else would I do? And I've always been a nurturer and a carer. So I thought, let me be a doctor. But that didn't happen. So I chose nursing.
Okay.
And I'm glad I did. So I trained in Australia, in Perth, in Western Australia. I did my nursing there for 3.5 years, and then worked for 2 years and came back to Kenya. And I was still not in maternal and child health. I was working at the accident and emergency here in a private hospital, which I loved. And the moms that I used to get who are in labor would be moms who've just given birth in the car, or the baby's crowning, and it's like, oh my God,
wow,
we're running
yeah.
helter-skelter. And I loved it, And what I found was moms were so fearful. First of all, pregnant and thinking that there's a crisis about to happen, the crisis of labor and birth. And I'm like, no, it shouldn't be that bad. And the uncertainty of, will their baby be born okay? Will they be healthy? But I did 2 years at the accident and emergency, and then I left when I got my first child because it was shift work, and I'm like 12 hours, 14 hours here. It wasn't working for my family. So I stayed home, and at the time I was doing my master's. So it was full on for me. Then I got my second child 2 years later. They're exactly 2 years, 5 days apart.
Wow.
Both born in May. I know. So they're soon to be 9-year-old and soon to be 7-year-old daughter.
Wow.
And while I was with my daughter, she was 6 weeks, and a doctor neighbor came to me and said, you know what, you look like you've got everything figured out. What can you come to my clinic to talk to moms, because she knew I was a nurse anyway, about taking care of their babies.
Yeah.
And I said, yes, I can. But then I thought, wow, I can actually do that. So I can actually charge and get moms. So I'm trying to say how I started teaching moms and educating moms about, you know, pregnancy and birth. And that's how Nurturing Moms started.
So when you say as a child you were a nurturer, you like to nurture. Are you the eldest sibling?
No, I'm not.
Okay.
well, my parents will introduce me as the last born, but I'm a twin. So I have an older sister and then a brother and then myself.
Okay.
Both of us are twins.
Wow.
So I'm the first of the twin. So I'm older,
Oh,
5 minutes older.
5 minutes, okay.
So I'd say I'm the middle, but
Yeah.
yeah. So a family of 3 and then my mom and dad.
So did you learn this maybe from your mom or your dad?
No, I think it was just inborn.
Okay.
I was always meant to nurture people.
Were you
care
looking
for
after
them.
your dolls when you were a little girl?
Of course.
Pets, animals?
Well, I had a dog, but a lot older.
Okay.
Yeah, and then I have an auntie who I'm named after who was a nurse, so I think I took after her.
Okay.
Yes.
That's amazing. I mean, the whole journey, it sounds so organic. You know how you went into nursing and then you came back here and then you found a
found my
space.
niche, yes.
Yeah, your little niche. And like you said, you know, where you had that light bulb moment where you're like, actually, I could make a career out of just this.
Yes.
Yes.
And I was like, I'm already supporting so many of my friends. Like, oh, sure, I have a flu. Can I take Piriton? Can I do this? Or what do I do? I'm having trouble with breastfeeding. And I was really educating them because of my background. But then I realized actually there really is a need. There's a gap. Moms go to the hospital to see their doctor in the clinic and they sit in the waiting area waiting for their turn, and then it's finally their turn and the doctor is like, okay, so how are you doing? Are you okay? Is baby kicking? Or come lie in this bed. Let's check. And in 10 minutes you're out.
Yeah.
And she lives there thinking, oh, I forgot to ask this and I forgot to ask this. And so that's where Ciru comes in.
Yeah, that's amazing.
Yes.
So you're also a doula.
I am.
Okay, for those of us who don't understand the term, please explain it.
So a doula is a female servant. So this is a woman who supports another woman throughout her labor or her journey of motherhood. Okay. Now there are birth doulas and postpartum doulas.
Okay.
So I'm a birth doula. So I will support you through your labor.
Push, breathe,
yes,
breathe.
First, well, doulas focus a lot. The birth doulas focus on the art of birth.
Okay.
So before we get to breathe and push, it's positioning. How should I sit? What should I do? How do I help my baby?
Dance.
Yes, move around, dance. How do I breathe? And, you know, that really helps a mom, knowing where to touch her, how to touch her.
Wow.
Educating the dad as well on
the
what
same.
to do, because half the time they're like, what do I do? Because she seems in pain. Should I be here? Should I be out? So allowing him to be part of the process as well.
You know, Ciera, this is extremely interesting because as a mum, my firstborn was born 10 years ago.
Oh, wow.
Yeah, so, and you were unavailable.
Yes,
you only got this idea 7 years ago. Yes. My secondborn he's 6 years old. But I remember looking, like scouring through the internet, looking for information.
Yeah.
I got a book, I'm sure you've heard of this book, the famous nurse who wrote this book,
Gina Ford.
Yeah. So I because all my friends who had babies at the same time as me swore by Gina Ford.
Yes.
So that's what helped me. But I really tried to read as much as I could. And I realized that when I started breastfeeding my daughter, it was the education that I gave myself that is what helped me.
Yes.
Expect or know what to expect. But you see, this is the thing. We aren't told. We're told, oh, you're going to be a mom. Oh, you're going to be a dad.
Yeah.
And then you think, oh, great. And you think it's going to just happen.
Exactly.
But it's important to have knowledge around so that you're not struggling.
Yeah.
So when your nipple is cracking, there's a way to handle. I remember with me, I was told, friends told me, 6 weeks before you give birth, start putting Vaseline on your nipple so that if you're breastfeeding, it's not as painful.
It won't crack.
Why do you think it is that it's only recently that we've been able to access this information from people like you?
Well, I think it was believed that, it's a natural process and your body will do what it needs to do and you'll be fine. But moms are now realizing, wow, this is a powerful, powerful rite of passage. I actually need to be educated. Then I can know exactly what to do. So like when it comes to childbirth preparation classes, I teach childbirth classes. Why? Because I want these moms to feel supported. I want them to feel educated, and then they will be empowered to make the right decisions. They get to learn, you know, the little skills, the tricks of how to help the process be a little bit easier. What do I need to do? You're just not a passive participant in your labor as a mom. You want to curl up in bed and lie down, but you actually need to be moving, acting, active, changing positions to help the process go along faster. Then how will I know what decisions to make? So informing them in the right way so that they make informed decisions.
Exactly.
So it's not only about the doctor. Oh, you think, okay, I have such a good experienced doctor, I don't need to do childbirth classes, I don't need to do this. And they don't realize the doctor will come at the end when you are fully dilated.
Yeah.
And the nurse, she's not going to sit there with you. She's got 3 or 4 other moms.
Yeah.
So how will you, Pinky, be able to cope? So I teach these moms on the different little skills, and we try and act it out. And this is what might happen. This is what you do when this happens. And one of the things I teach the moms is an acronym called BRAIN. When you're faced with a decision and you don't know what to do, think of BRAIN. So it's an acronym that stands for your benefits. So what's the benefit of what the doctor is telling me to do? What's the risk? What's the alternative? And what am I feeling? What's my intuition telling me? Should I or shouldn't I? Because women have such a strong gut that we feel, and N is if we do nothing. So then that helps a mom make a decision when she's in hospital and she's confused. Yeah, and then the partner gets to understand his role as a primary caregiver. If they're not going to have me as their doula, you're going to step into my role, and I try and teach them what to do when their wife's in labor. And at least these days, they allow the partner there. I know there's some rural health facilities that they don't. They're like, you just stay out outside, and we'll handle her. But she actually has a much better experience when she has a loved one with
close
her,
by,
because there's one thing that women will never forget is their birth experience. And you want it to be a good experience, because you don't want it then that she's regretting every time she thinks about it. She's like, it was such a horrific, traumatic
I've heard that from
experience
women as well, and then it stops you from thinking about the next child.
You're
like never again,
ever again. And you even go into depression because of you had a traumatic birth experience. And it's a traumatic birth is different from for every mom. For a mom, could be that she went through a cesarean section and she really wanted a vaginal birth, and she feels her body let her down. For another mom, maybe her doctor didn't make it
on time, and then it's a different doctor.
And she's like, it's a different doctor. I had built a rapport with this guy or this lady, and now they didn't show, so they're disappointed. So it can be different things for different moms.
So you take a mom through her pregnancy as well?
Yes, from 28 weeks.
Oh gosh, where were you when I was constipated? I remember those days, and I was like, oh my word. And then you see, like, again, not having anyone to talk to.
You don't know, and you're thinking, if I call my gynae, this is not that.
It's not that
I don't want to disturb that. But if you have someone like me to call and say, this is what I'm experiencing.
I'm struggling.
Yes, is this normal? Is
like,
this not?
Do this, do that.
I'm like, try these natural remedies, do this. And it's like, wow.
And also to hear someone say, don't worry, it's so normal.
Exactly.
So you're not...
but when moms don't have access to someone like that, because it's not only me, there are others, they end up Googling.
Oh, Dr. Google.
Yes, who's not your doctor? He's not your doctor. And he tells you all these things, and you're thinking, my gosh.
Yeah, it's the worst thing ever.
Yes, so now something is really, really wrong, and actually it's not, you know? Or you read about mom's experiences, and you think it's going to be yours. No. So why not go to an expert who can take you through this calmly, patiently, teaching you and helping you prepare for the best birth possible.
Wow. And, we were talking about this off camera, Ciru, when it comes to the best birth possible, right? Are you any less of a woman if you've had a C-section?
Absolutely not. No way. Don't ever think that way. It's just another safer mode of delivery. Your baby's going to come out one way or the other, vaginally or through a cesarean section. And unfortunately, moms who go through a cesarean section feel they're less of a mom, or are made to feel less of a mom.
Are made to feel.
Yes.
Why is that? Why do we do that to each other?
Because it's so wrong, really. I mean, every mother wants to be able to feel that she did the best that she could for herself and for her infant. But there are moms who make you feel like you copped out. You took the easier way around, but actually cesarean section is not easier.
It's not.
The recovery
difficult,
is
yeah.
really difficult. But moms who are not sure, should I choose a CS or choose a vaginal bath? I said, choose the vaginal bath.
Yeah.
Because you heal better, you heal faster. Because the cesarean section, the pain after is a lot more severe, but never feel less of a mom if that's what the card that you are dealt.
You know, they also say like maybe the child has lost out on something. When it's delivered vaginally, maybe they get more tougher, or I remember I was told, because both my babies are CS babies, you know, take your children into tunnels so they feel like they've experienced. I'm like, what?
Yeah.
How does that? Have you ever heard of that?
I have, and what I know, that one of the main differences with a vaginal bath and cesarean section is one, the baby, as they go through the tunnel, through the vagina, they're squashed in there.
Okay.
The extra fluid from their lungs comes out. Okay. So they experience less difficulty in breathing compared to a baby who was born via cesarean section. They may need a bit of oxygen after the bath, but they recover within a few hours and they're back to the mom.
Yeah.
Actually, there's also one thing, it's called spooning, where they get a swab and swab your vagina, and they put that in the little holes, the ears, the mouth of the baby, the nose. Then they get the good bacteria that comes from the vagina. So as they go through that tunnel, then vaginal baths, babies get that. For a C-section, it's done, but it's done abroad. Here, it's not a thing that's caught on yet.
Okay.
Yeah.
You think it will catch on here?
I don't know.
Maybe as more mothers get more knowledge.
Yes, they may actually advocate for themselves and ask the doctor, could you, as you do it, can you please do it for my baby?
Something that I've read as well is the whole thing about the umbilical cord.
Yes.
And how it shouldn't immediately be snipped off.
Yes.
Have you heard about that as well?
Absolutely.
Is that something that's happening now, or is that something that, you know, is happening more maybe in the West? And why shouldn't it be cut immediately?
That's an awesome question. It is happening now, which I'm so happy about. And it's actually being promoted by the World Health Organization that wait at least 2 to 3 minutes before you clamp and then cut the cord, because then the baby needs to get most of the blood, because there's blood circulating between the placenta and the baby. So if you separate the two too quickly, then the baby misses out on their blood that was in the placenta. And babies whose cords are cut too soon tend to get anemia at about 8 months of their life.
Oh, wow.
So to avoid that, just wait. You know, it used to be a medical emergency to separate the baby immediately they're born, but not anymore. If you have a home birth or a bath that's conducted by a midwife out of hospital, they actually wait for the cord to stop pulsating.
Really?
Yep, it goes limp, it goes white, and then that's when they separate, because all the blood has gone to the baby.
Wow.
But that's true. It's usually about 30 minutes. So in hospital, the doctor's like, oh my gosh,
I gotta go.
I gotta go. It's too long. It's waited too long. So 3 minutes.
It's good enough.
Yeah.
So maybe also that's something mothers need to know, and maybe request that if it's not happening.
Now it's caught on with most doctors.
Yes.
It's caught on. Those who are a bit feeling like it's taking too long, you almost see them trying to milk.
Really?
Milk the cord.
Okay.
Yeah. Blood to the baby.
Yeah.
But majority know that, you know what, just wait. Wait for the blood to go to the baby.
So while we're talking about, you know, the umbilical cord and the placenta, there is that fad of eating the placenta. Have you heard of that?
Yes, I have.
I because of my CSs, I've never seen a placenta.
Oh, really? Okay.
Yes, I know, it's interesting, but I know sometimes they show it to the mother, right?
Yeah, they should. They didn't show it to you?
They didn't show it to me.
Okay.
I think I just didn't. I'm you know, I can't.
Yeah,
I
blood.
can't. I'm very, very like, what's the word? Queasy, wheezy.
Grossed out.
Yeah, I can't. But a lot of friends of mine have told me, especially when it's a vaginal birth, they pull out the placenta and they put their hand in it. So
they want to see that.
Just check it's all
there.
And they show you.
Yes.
What are the benefits of this placenta?
After the baby's born?
Yeah. Why are people eating that placenta?
I really don't
making
know.
soup.
I haven't
or
read any.
Or
I go by science.
Okay.
Yes, some are actually blending it into a smoothie.
Yeah.
Putting it in the oven. There's placenta encapsulation where they put capsules and then the mother can ingest them. I haven't found a study that says that it's actually of good benefit to the mom. But those who are ingesting it are saying, I mean, really, if other animals are doing it, why not humans? But the reason why animals do it is, one, they're hungry. They're trying to hide any evidence of birth so that then there's no predator that will come and kill their newborns.
Their babies,
those who actually ingest it, they actually say they get more energy, lower risks of postpartum depression. This is not science-based. I'm just saying what they say.
Yeah.
They get more milk. They're less tired, so that because they're taking in back their blood, they don't have anemia. But I don't know. I feel, in my opinion, if the body rejects it, because the body actually expels it.
Yeah, it's like, whoop.
Yep,
and
after
then,
the birth,
baby's
out, then the placenta follows.
just comes out,
If it was meant for us to take it and was good, then our body, why would you
not reject, like take
not
it
expel it?
Yeah,
it would stay in.
Rather,
So
it's a debate.
It's a debate, but it's actually being done in Nairobi. Somebody will come, and collect the placenta. So these days they'll actually ask, do you want to keep your placenta or shall we discard it for you? It's no longer medical waste. You can take it home. You can even plant a tree, use it as manure.
Oh, I would have loved to have done that.
As the tree grows, the baby grows, and your stuff is
there. It's helping this tree grow. That would make sense for me.
Okay.
Yeah, I don't know about ingesting a placenta. If I can't look at a placenta, I don't know
about ingesting it.
I don't know if I can ingest it. But then it brings us to this question of stem cell banking, and I've banked my son's stem cells, and I'd just like to know, again, when it comes to Kenya or Africa for that matter, how many women are aware of stem cell banking, and what are the benefits of doing that, and what's the procedure even?
Yeah, so not so many are aware. I think only if you attend a childbirth class and your educator has been exposed to it and is well versed and knows about it, then they will tell you about it. I think one of the limits is the cost implication, because it's not cheap.
Yes.
But it's of great benefit if you have access to do it for your baby. And it's something you'd have to have planned before.
Sure.
Because it would need to be collected right
immediately.
Yes. Yeah. When the birth has just happened, somebody comes in, actually do collect them. It's amazing. I love it.
Really?
So we come in, take out some blood from the cord, fill it in a blood bag, and then cut part of the cord and take it and store it and do all that. And then it's taken to the airport.
Yeah.
And they send it to South Africa or to the United Kingdom, and it will be kept there for your baby to use maybe 25 to 30 years.
Yeah.
If they ever need it, should they need a stem cell from whatever issue they may be having, or if they're going through blood cancer, or they need a bone marrow transplant, or they need to grow an organ, all manner of things, they will just need to use their own. And a sibling, I think, can also use it. Yeah.
Wow. And that's available.
It's available.
I mean,
it is available.
I know.
It's just that it can be pricey for some people, so then they're not able to do it.
Yeah.
But if you can and can afford it, I'd say go for it.
I spoke to a dentist who says even teeth, their first teeth that fall out, babies' first teeth, you should keep them because that also has stem cells.
I didn't know that.
Yeah.
That's amazing.
Isn't that interesting?
Definitely.
But it's amazing at which direction we're going in regards to all these new discoveries and how we can heal ourselves.
Yes.
And as someone who's, in it, you've studied it, do you think the body can heal itself?
I think so.
Really?
Yes.
It's powerful enough?
Yes.
How?
One of the things I think disease is just dis-ease. You're stressed, you're worried, you're depressed, you're not at ease. So your body gets sick. Even out of stress, your organs will start to shut down. So we can actually heal our own bodies, and using the right foods, doing the right things, ingesting the proper foods with a balance of nutrients, the micro, the macronutrients, our bodies can heal themselves.
Yeah. Do you think our health starts in our gut?
I think so.
Yeah?
Yeah.
I think so as well.
I think so too.
Yeah, I believe
so you are what you eat?
Yeah, you are what you eat.
Yes.
I used to hear that so much, but it's only recently until I've actually taken it seriously and studied it in the sense, read about it and read and read and read. And the amount of pesticides and hormones that are in our foods, it's very unfair.
Very.
you know?
So people are trying now to grow their own food so that you
foods.
know what you're actually eating.
Yes, that's it.
Yeah.
And when it comes to this global pandemic, what would be your advice, you know, when it comes to looking after your immunity? How should we look after ourselves?
One of the things you've got to first do what we've been asked to do. Keep away from crowds. Do your social distancing. Wear your mask when you're outside. Wash your hands. Now is when
That's
we've been
a given.
I know. We've been so exposed to
Yeah.
germs. I mean, you go to a shop and you even see the shopkeeper, they've touched your money and they just want to fast sanitize.
Yeah.
We now realize where germs can be and how we can
Yeah.
easily transfer them.
Sure.
And then again, trying to eat a well-balanced diet. We've been told that vitamin C, vitamin D, zinc, iron, all those things are good to fight because they're building our immunities.
Yeah.
So eating well will ensure your immunity is high,
Yeah.
and your body can be able to fight these diseases.
Yes.
And even for moms who are breastfeeding, I'm like, continue to breastfeed your babies.
Yeah, that
Even
boosts-
if you are feeling you've got to supplement, try to still breastfeed, because you know when you're breastfeeding, you're passing these antibodies to your
To your
baby
child.
and ensuring that their immunity is also as strong.
And that's what I wanted to ask next,
Yeah.
is, you know, about this, if you're a new mom in a pandemic, scream,
Yeah, exactly.
you know. So how would you advise moms? What would you advise moms on how to be wary about themselves as they're pregnant, and then as they deliver as well? How do you look after an infant?
I know, bless them. I
Yeah.
mean, when you're pregnant, your immunity is sometimes a little lower.
Yeah.
Okay, because your body is so everything
focused
is focused
on building
on
this
building
baby.
and growing and
Yeah.
developing your baby in the womb. So you can easily get a flu, an infection here and there. So you've got to protect yourself. Ensure you're eating a well-balanced diet so that then your immunity is still high. If your doctor feels you need to take supplements,
Yes.
please do. Take them and ensure that you stay healthy, you stay strong, but at the same time, there's usually so much uncertainty and anxiety in general.
In general.
Leave the pandemic out.
Yeah.
There's a lot of uncertainty and fear, and moms are not sure what to do. So they need somebody to walk beside them
Yes.
and tell them, look, do this. And don't worry about this.
Exactly,
This you don't need to worry about. Let your body do what it needs
Yeah.
to do. Because little things like, I'm worried that my baby's going to be a small baby. Just eat well, stay away from stress, and
Yeah.
your body will do what it needs to do.
Yes.
You know?
Yeah.
So moms need a lot of encouragement. And when it comes to the pandemic, do what everybody else has been asked to do.
Yeah.
Keep washing your hands, proper hygiene. If you have a flu and you're breastfeeding, wear the mask. But if you can't, please don't stop breastfeeding.
Breastfeeding is
Yeah.
essential.
Yeah.
It's really important.
Yeah.
And like I said, it's it's also very, very important that we have a voice like you. Someone I can call, someone I can reach out to when I'm a bit unnerved. I'm
Yes.
like, I'm unsure of what's going on over here. I'm so
Yes.
scared of this. I know that there was when it comes to our health and everything, when we've spoken about moms, let's talk about this comparison that moms have. You know, we're always
Comparing.
So your baby sleeps how long?
I know.
What would you tell moms?
Let me tell you, there is just so much pressure.
Yeah.
Honestly.
Yeah.
I mean, think of just the first 4 questions a new mom is asked.
Yeah.
So you go visit your friend in hospital. There are 4 main questions you tend to ask that mom. Was it a CS or a normal?
Yeah.
And she says,
breastfeeding?
are you breastfeeding? What's the weight of your baby? You know, so she says it was 2.2, and you're like, oh, really?
Oh, sorry. I don't like that. Sorry.
Yeah. Why are you saying so? And then our mom says 3.8. You're like,
Yeah.
well done.
Yeah.
Good job. You really did a good job with that pregnancy, you know? So mom guilt starts really
Oh,
early.
yeah.
Really early. And we are the ones who are causing moms to feel depressed, unsure of themselves, because you're like, oh, your baby's not sleeping through the night. And let me tell you, Pinky, sleeping through the night, that baby's waking up. But she's just nursing for 5-10 minutes and they're back asleep. Sleeping through the night could come even at 9 months,
Yeah.
not at 4 weeks. It's unusual. And if it's happening to you, then you're just an outlier.
Yeah.
Majority of babies will wake up. And because of this mom guilt, I tell moms, ask yourself 2 things. Can I do something about it? Yes or no? If you can, then learn and do it next time. If you can't, have done anything different. Things like inappropriate guilt. So she says, oh my God, I feel so bad because I was so pressed that I needed to go to the toilet and left my baby there crying. And now I feel like such a bad mom. You had to answer to the call of nature.
Yeah.
You had to go. So then why feel guilty about it?
Yeah.
Could you have done anything different? Yes or no? No? Then let it go.
It is what it is, yeah.
It is what it is.
Yeah.
But I think it's that thing of trying to feel really perfect and doing everything right. And you realize super moms are not pretty. They are stressed, unhappy, irritable, tired, haggard. And moms just need to raise their hand and say, please, I need help.
I need help.
Please come and help me. I need help. But
Yeah.
some feel if I'm asking for help, it means I failed.
I'm weak.
I'm weak. I can't cope. Babies were not supposed to be brought up just mom and baby.
By one person.
Exactly. You need a community to
Yeah.
help.
What are the signs that we need to look for when it comes to baby blues or postpartum
That's
depression?
a good one. 80% of moms
We'll go through it.
baby blues.
Yeah.
80%. So it's actually considered normal now.
Oh, wow.
Yeah, that a mom will go through a period where she's a bit teary, she's overwhelmed. You're all thinking, gosh, you should be looking excited that you had a baby, but she's just feeling, I don't know if I can be a good mom. And it starts on the 4th day and it goes on, 4th day after birth, and it goes on for 2 weeks.
Wow.
So I've had 2 children and I've gone through baby blues twice. And
Yeah.
it's simple things like, oh, I told my husband to come home with, let's say, diapers.
Yeah.
The ones I have are a little bit big, please buy me a smaller size, and he forgets. And I start to cry. Like, you forgot. You start to
forgot
cry.
our baby.
I know, how could you forget? And he's looking at you like, what's wrong with you? So I always tell dads, please, be very mindful that you should not judge her. Acknowledge that you see she's upset. I see you upset and I'm sorry. What else can I do for you?
Yeah.
Because it's hormonal. There's nothing she can do about it. I talk to moms and they've had such an amazing birth experience, but she's got tears. And she's like, I don't know why I'm crying, but I'm crying. I'm like, it's not you. It's the hormones. But at 2 weeks, they stabilize and she feels better. She's happy.
Yes.
She's excited.
Yeah.
But unfortunately, if it doesn't lift off that feeling of your being overwhelmed, you're snappy, you're sad, it can get into postpartum depression, which happens to about 20%.
So that's when it
So now you
spirals
down, you're not sleeping,
Yeah.
you're constantly anxious about your baby, so that's postpartum anxiety.
Yeah.
Even with reassurance, you're like, no, something's wrong with the baby. And they're like, no, nothing's wrong with the baby.
Yeah.
You are not sleeping, you're not eating, you're constantly tearful. And some even think of harming their own babies
Yeah.
or themselves.
Yeah.
That I don't think my baby deserves having me as their mom. I'd rather die.
Wow.
Now with that, you need to be hospitalized because then you might need psychiatric
help.
or some counseling. Yeah, but if it's not that severe, then you just maybe start to journal and write exactly how you're feeling, but also say, what am I grateful for?
Sure.
What's happened today between me or my baby that I'm really thankful for? Because motherhood is hard.
I know.
It can be really tough. And if you've had expectations about, oh my gosh, my baby's just going to be like Pinky's, sleeps through the night, gets on a schedule easily, everything,
Yes.
and then yours is like, my reality is so different
It's
from
so different.
what I expected. That can also cause you to go to a spiral.
And it's one size doesn't fit all.
No, we're all so different. Even one baby compared to another.
Yeah.
You can't compare them. Like, oh, my firstborn was so much easier. Yeah, God always balances.
Yeah.
Gives you.
Here you go.
Yes.
Talk to us about your highs and your lows in this world of yours.
Oh, my highs is when a mom writes to me and tells me, I think you were the best decision I ever made.
Yes.
I'm so glad I chose you to walk beside me through this journey because I feel so much confidence as a mom. I know what to do. I'm not panicking. Or my labor and birth experience was exactly what I wanted it to be because of you.
Yes.
And I'm like, no, you did it.
Yeah.
You were there. I was just there to support you, but you did did what you could and what your body was able to do. But these moms feel so empowered.
Yes.
And I believe it's because I prepare them to know what to expect, know what to panic about and what not to panic about, empower their partners as well, because their husbands also are such a solid foundation for them that they need to know what to do. And I've got so many babies. I call them all my babies.
I'm sure.
You know?
Yeah.
But there are lows in my line of work, and my lows is usually if a mom loses her pregnancy, her mom loses her child. And I've had a handful of those, and I would not want to have more, but they are there. And the reality is there are women who go through miscarriages. Actually, the statistics say 1 out of 4. I'm so sorry.
Yeah, no, it's my journey. It's for sure my journey.
Yeah.
I've had 4.
I am so sorry.
Yeah. Thank you.
And it's devastating. And one of the things that makes it harder is that moms don't talk about it. They choose to be quiet and say, you know what, it happens, so let it be. And in any way, it wasn't a baby. It was small.
It was not 12 weeks. It was
as long as you have heard their heartbeat, you have connected and told your body that, wow, we are actually carrying a child. For you,
it was a child.
It was.
Yes, absolutely.
Okay, so whether it was at 12 weeks or at 40, you've lost a child. So I do walk a journey with these moms and try to just help them know what to do. If it happens again, allow them to have an idea of what are their options. If your baby was almost full time and you didn't bury them, or you didn't take mementos of their footprints or their handprints or a lock of hair, or even being able to hold them or name the child. You know, you say 4, but do they have names?
Yeah.
We should actually name them because they lived. They had a heartbeat. So my lows are that, but I still feel that at least I get an opportunity to walk a journey with these moms.
Yeah. And that's another thing, you know, the whole conversation around that this does happen.
Yeah.
And it is normal. It does happen.
It happens.
Like you said, 1 in 4 women. I remember when it was happening to me, they said it's 1 in 3 pregnancies within your body that you will miscarry. So when it was so many, of course, you know, doctors were like, what's going on with this one? But it's, again, when I'd go to the hairdresser, because I'm a talker. This is how I find my healing. So when I tell my hairdresser or my friend or my cousin, everybody around that, you know, the coffee table or in the salon would be like, yeah, me too.
So you were shocked by how many of them, and you didn't know about it before.
Yeah. And that's why I think it's important. So do you say you're sort of like a therapist as well?
I think so.
Because if I call
you end up counseling these moms.
You do, right?
You do. You always, you end up holding space for them.
Yeah.
And trying to just be there and encourage and support, and sometimes even say nothing but be present.
That's it.
There's a ministry of presence. You know, you've lost a baby, and if I have nothing to say, just being present helps somebody feel encouraged.
Which is so important.
Yes.
What would you say we need to unlearn when it comes to pregnancy and motherhood?
I think we need to unlearn that what labor and birth has been portrayed is that it's horrific, it's painful, it's the worst pain you'd ever go through.
Oh yeah, that's one thing. Yes.
Yeah, so we need to unlearn the thought of you're planning for a crisis.
Yeah.
You're planning for this crisis that's going to happen, that's going to change your life. It's not, it shouldn't be that, because if you think of it being a crisis, then what emotion do you think you'll have?
Panic.
Fear. And all those things are not needed when it comes to your labor and birth experience, because it makes it worse. You know, because they talk about a fear, tension, pain cycle. When you're fearful, you've got tension. And when your body is tense, then the pain is more.
Sure.
So we need to unlearn that it's not a crisis that you're planning for and expecting. It can be beautiful.
Yes.
So don't walk the journey alone. Have somebody walk beside you. Not only your doctor, you need a doula, you need a childbirth educator, you need a midwife to be with you and just encourage you.
Yeah. Where do we find you?
Wow. So Ciru, you can find Ciera on Facebook and Instagram under Nurturing Moms.
Okay.
I'm also on YouTube. I have a YouTube channel called Nurturing Moms that has like 140 videos of everything that a mother may think about with regards to her journey of motherhood.
Yes.
Also for wannabe moms, you can learn something from that as you plan for your journey.
That's amazing. And like I said, I wish I had this information while I was going through my journey of, becoming a mother. But it's phenomenal that we have this available here. So thank you, Ciru.
You're welcome. Thank you for having me. I
No,
feel
of
so honored
course.
to have met you and been here in your space.
Yeah, no,
I appreciate
I think
that.
it's so important to have these discussions. And like I said, for me, my role is to let people know what's available, to make their lives, especially women, to feel like they are in charge of their lives. And like you said,
Exactly.
childbirth is such an important part of our lives as women. And if you have as much control as possible in that,
Yes.
like for me, I was fear, labor pain. Whoa!
You're like, I'm not doing
I'm
that.
not doing that. But had I spoken to you and you counseled me through it, it probably would be different. So it's such a great thing that you are here and you are available.
Thank you.
Ciera and I would love to hear from you. Leave us a comment. Let us know what you think. Are you a CS mom? Does that make you any less? Do you breastfeed your baby? Does it make you any less if you cannot breastfeed? And also, are you one of those moms who judges other moms?
Yeah.
I
We
don't
need
know.
to stop
I don't
that.
know if they would comment. Yes, I'm one of those moms. But think about it, because the next time, maybe you show some empathy towards a mom. Thank you once again, Ciru.
that.
It's
You're
been
welcome.
such an honor. So nice talking to you. So nice to hear what's available in Kenya.
Yeah. You're most welcome.
Remember, on this show, we encourage you to be brave enough to learn to unlearn. This is our season finale, and I want to say thank you so much for being with us through this journey where we have managed to learn and unlearn. We'll see you again in season 4. Bye-bye.